Y'all to have a doctor tell me we don't come in those COVID rooms. I'm like, what? What I experienced this past month there was horrific. I don't know. So of course, I was in El Paso, Texas. For some reason, the doctors there did not aggressively treat those COVID patients as they should have, as I have experienced before. So I saw a lot of people die that I feel like shouldn't have died. Y'all, that assignment there broke me. I was put in what's called a pit. And in this pit was 8 patients, all COVID positive. My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag. And because they were COVID positive, this hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. Out of all the codes that we had there, there's not a single patient that made it. Y'all, the morgue was so full of bodies that they had ran out of room. So once the doors open to the pit, they come wheeling in a body already in a bag, lined them up with the rest of our alive patients because they had to store the body in there because the morgue was out of room. They've had to bring in freezer trucks because there's so many bodies. I remember calling a doctor one night, and mind you, we as nurses sit in this pit for 12 hours. The only time that we in full gear, the only time we leave that room is if we go to the bathroom or we go on our 30-minute lunch break. I remember this man bleeding profusely, and I remember calling the doctors that was there. Y'all, to have a doctor tell me we don't come in those COVID rooms, I'm like, what? Y'all, the doctors don't even step foot in those COVID rooms to see those patients. I was there almost a month. I never once saw a doctor come in that room because they were COVID positive. Y'all, I feel like the treatment that those patients there are getting, when I say it did something to me, I literally, the first hour of my drive home, just cried. We as nurses, it's okay for us to be exposed. But you as doctors, you do not even come in there. You can't get exposed, but we can. And y'all making all the money. Okay. Why is Texas not being broadcast like that? Texas has surpassed New York. We had 4 freezer trucks. 4. They had to show up because it was so many people dying. If those doctors there would aggressively treat those patients from the beginning, a lot more would make it. Y'all, and the saddest part about it, my first night there, as I was getting orientated, the nurse that orientated me had one patient that was called the VIP patient. She was a doctor's wife. And when I say they pulled out all the stops for that woman, it wasn't nothing that they didn't do for that woman. And guess what? She was the one patient that made it out of that ICU alive and was able to downgrade to a long-term acute care. So you mean to tell me because she's a doctor's wife, her life meant more than any of those other patients?
This is from The Guardian. El Paso inmates help move bodies into morgues as COVID deaths soar. Use of inmates temporary until Texas National Guard able to help, said Sheriff's Office as facilities in area overwhelmed. The footage, which spread rapidly on social media, 9 inmates wearing the striped jumpers of the El Paso County Jail helped move bodies into mobile morgues. This is from November 22nd, 2020. Having to use inmates tells a story of how shorthanded we must be, El Paso County Judge Ricardo Samaniego told local media as he struggled to cope with the rising tide of COVID-19 in the West Texas city on the border with Mexico. The sheriff's office said use of inmates began on the 9th of November on a volunteer basis. El Paso County said the inmates were tested and provided with personal protective equipment by the medical examiner's office and would face a 2-week quarantine once the program was over. They were being paid $2 an hour. It was just a temporary focus. We're waiting for the Texas National Guard to help us out with that, said Samaniego. In a response to outcry on social media over the use of inmates rather than trained medical professionals, a spokeswoman for the El Paso County Sheriff's Office told The Guardian the inmates work would end when the National Guard arrived, Samaniego, however, wasn't sure those troops were coming. It has not been confirmed that they would be able to take over the demand that we have at this time. The El Paso County Public Health Department has confirmed more than 800 deaths since March. Another 400 are under investigation. In other words, they haven't been confirmed by a test. El Paso has called in more mobile morgues in recent days, up from 6 to 10. Authorities in El Paso fear a dire situation could get much worse. Facilities are overwhelmed. 1,100 people are hospitalized with COVID. In an emotional, near-hour-long video on Facebook, this is one I showed you, Lawana Rivers, a nurse who came to Texas to help, described the dire situation. The only way those patients was coming out of that pit was in a body bag, she said, referring to the COVID unit where she was working. I'm not okay from an emotional, mental standpoint. Rivers claimed the intensive care treatment at the University Medical Center, UMC, was not aggressive enough to save lives. This hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. This out of all the codes we had, there's not a single patient that made it, Rivers said. El Paso was her 5th assignment during the pandemic. Close to tears, she said working there had left her more emotionally scarred than working in New York. Wow. And New York was a hot spot, which was the world's worst hot spot for infections in early spring. In a statement, UMC said, after watching the video, we cannot fully verify the events expressed. We emphasize and sympathize with a difficult physical and emotional toll that this pandemic takes on thousands of healthcare workers here and throughout our country. This particular travel nurse was at UMC briefly to help El Paso confront the surge of coronavirus patients. Rivers chose to leave her assignment early and return home to her family. I do not blame her. Behind the numbers lie thousands of names. Jojo Sanchez was one, a 74-year-old former emergency medical technician who became an emergency room technician. He lost his battle with COVID-19 on the 12th of November at Del Sol Medical Center, where he has helped so many. He watched so many of us grow up, and he had a shoebox of photos from people that worked there from way back, said Barbara Yoon, a coworker. He was everyone's grandfather. Sanchez battled COVID-19 for 3 weeks. His family was not allowed to visit. His friends from the ER stopped by frequently, so he wasn't alone. It's a bittersweet ending to a man that truly loved, Yoon said. UMC is just a few miles from the state's border with New Mexico, where the governor, Michelle Lujan Grisham, has re-implemented a stay-at-home order. New Mexico has just seen over 70,000 cases since the pandemic began. El Paso County alone has recorded about 7,000 more than that. Samaniego recently issued a stay-at-home order. It was quickly challenged by the mayor, D. Margo, who appealed to the Texas Attorney General, Ken Paxton. The Attorney General ruled the shutdown illegal, only for it to be confirmed in a state court, then overturned again on appeal. El Pasoans were left confused. There are businesses that were shut down where others remained open, Debbie Mendez, El Paso mother. If there is no stability with city officials, the citizens of El Paso will basically do whatever they want, and COVID cases will continue to rise. One El Paso gym was among the businesses which decided to stay open, even after the state court ruled San Diego's stay-at-home order could be enforced by police. In a statement accompanying a fundraising account, the owners of Sun City Athletics claimed they have received 2 warnings and 2 citations. Citations are up to $500 each. The GoFundMe amassed more than $4,000 in less than 2 days. After the appeals court struck down the order, the gym said it would refund all donations. El Paso is faring much worse than Houston, Dallas, San Antonio, and Austin, the 4 largest cities in Texas. They have a combined 34,391 active cases among 10.6 million residents. On Wednesday this week, El Paso reported 34,819 cases among its 840,000 residents. Yeah, they have more cases. About 83% of the population of El Paso is Hispanic, a significant amount living in multi-generational households, according to data provided by the Public Health Department. 93% of roughly 77,000 people who have tested positive since March are Hispanic. The Centers for Disease Control and Prevention has reported that Latinos are nearly twice as likely to develop diabetes as white Americans, according to the El Paso Health Department. Diabetes and hypertension are 2 of the leading underlying conditions present in residents who have tested positive for COVID-19. In El Paso, patients with underlying conditions make up 97% of the death toll. And at funeral homes across El Paso, social distancing and capacity limits apply. But as the mobile morgues fill up, some families are experiencing a 4-week delay before they can even bury their loved ones. Yeah, I think I'll stop right there. That's enough. We've had people in our circle, especially online, our online family have come down with this and had have loved ones die. This is real, folks. I don't know what else do I need to tell you about this. If people said that it's a hoax, it's going to go away once Biden gets into office and Donald Trump is defeated. People said that it's planned so they can sell vaccines, which doesn't make sense because the money that they're losing doesn't make up for the money they will make off a vaccine. And you keep seeing evidence like this with people's personal accounts, okay? All over the world. I know people that have caught it. Some people have survived. I've heard some people have not made it. And I don't know how many more personal accounts you're going to have to see from people that are healthcare workers and people that are healthcare workers and all over the world, people giving their personal accounts. They've actually gone through their personal testimonies, and people still don't believe that this has any validity. I don't get it. I remember following this stuff, but I've been following this stuff since January. Now, I remember when Texas was pretty close to one of the lowest rates of infection, lowest rates of death in the country. And New York was first, New Jersey was second, and then on down the list. And remember, Texas was refusing to shut down and refusing to have any lockdown orders, even though they were protecting the borders. They weren't letting people in without tests. But now Texas is catching up with New York. Texas is the second state in the union as far as COVID cases and COVID deaths. I remember they were much less than California. I think at the time, California was in the thousands, and it was like almost 10,000, and Texas was like less than 1,000 cases. And now they've shot past California, and they're closing in on New York. New York has pretty much squashed its death numbers and its case numbers for the most part because of the severe lockdowns that they've had. But Texas, which has roughly like 60% of California's population, has 3 or 4 more thousand deaths in the state. And then it's amazing to me that this could go on and people not believe, and people still put people's lives at stake. And even the people that do survive, you got to remember, the people that do survive have severe damage to their organs. So this is not something to play with, because they're still studying long haulers. Long haulers still have severe conditions, man, 4 or 5 months after they recover. So, folks, this is nothing to play with. And, there's a longer piece that the nurse actually did. They just took like maybe 3 minutes of a 50-minute post that this nurse actually posted on her Facebook, and I might put the link in the description so you actually go look at the longer video. I scanned through the longer video, and like I said, the piece they put up was like maybe 2 minutes, and her whole post was like 50 minutes, which I was kind of surprised at. And she was actually saying the money's not worth it. The money's not worth what the psychological and emotional toll that it took on her. And El Paso is doing what New York did. Well, New York didn't even do that. New York was putting them on ventilators. They were trying to save everybody. And El Paso was just letting them die. And so in El Paso, like I said, they have 800 registered deaths, and they have another 400 that they're investigating. So they haven't even put up all the deaths. And Texas is known for that, man. Texas, Florida, and Georgia will actually not post the numbers if until they've thoroughly investigated. And all of a sudden you see a spike. It's like just one day they'll just post like 1,400 deaths. And you know that didn't happen in one day. That these were cases that they were hiding or building up, and then they decided to actually finally register these as COVID deaths. So they're hiding the numbers. And Texas probably has another 2,000 or 3,000 COVID deaths that they're hiding, along with Florida. So, folks, even if you don't believe in this, don't play with this, man. Our beloved Officer Charles has caught it. And he's personally telling us this is not something that you want to get. Even if you don't think you're going to die, this ain't something that you want to mess with. And everybody that I've talked to that has had it told me this is not something that you want to mess with. If you're going to avoid getting it, don't get it. Because even if you won't die, you're going to feel like death for like 3 weeks. Anyway, I just wanted to post this, and normally when I post something, I don't like to just post like a 2-minute clip. I like to bring some kind of context to it. So that's why I read the article. I'm giving my commentary after. And, you guys will go out there, practice your protocols, be safe. Evidently, the vaccine will come sometime next spring. In fact, they're already flying the stuff in. And they'll test it or not because they want to get the economy back on track, and they're willing to take risks with your bodies to do so. So I know some people will have to take it because that is part of their employment. First responders is first, military second, and probably the teachers will probably be third because they're going to have to open up the school system. Hopefully they won't require the children to take it. I'm hoping that they don't because I got a grandson. But eventually, to get life back to normal, we're probably all going to have to shoot up with that vaccine if you want a normal life. So I'm saying is don't be the first lab rat, okay? Because it's an experimental vaccine, and it's could be coming from 10 different sources. And so before you take it, before you allow them to put it in your arm, know where it comes from, do some research on it. Get all the data and literature the side effects that you can actually muster. So at least if you have to put it in your arm, at least you know what to expect, and you have some kind of countermeasure before that. But I assume that most people will probably be on it by summer of next year because this is the only way they can save their economy. And all I'm saying is don't be the first one to take it. And if you have to take it, then be forearmed about all the information that you can. But that's all I got for you guys on this one. This is BGS out, and I'll see you guys on the next one. Peace.